I'd like to welcome our listeners back to our podcast today. Adam, who do we have joining us?
Today we have Laura Marquez, Senior Director of Digital Transformation at the University of Utah, joining us. So Laura, welcome.
Great to be here. Thank you for having me.
Oh, it's our pleasure. We're so happy to see you again, and thank you for joining the session. So Laura, Dan and I got to meet you a couple months ago at a class event, our Digital Health Investment Symposium. And we knew within a couple minutes, we said, we really need Laura on the podcast. She has so much to offer and share with healthcare and our listeners as well. So number one, thank you for being here. It's our pleasure to have you. And will you just tell our listeners a little bit about yourself and how you got to your role today?
Certainly. Yeah, I'm excited to be here. I think that amplifying the patient voice is so important in healthcare today, and it really lends itself to, why I'm here. That is really my passion, is thinking about putting our patients and their families first and, moving us along this journey. So a little bit of background, I actually moved to Utah in the summertime. I came from Connecticut, where I was the chief application officer over all IT applications. And prior to that, I was in Seattle. So I've been in healthcare for over 20 years, in the IT space for over 10 years, and just really excited about the opportunity to, make healthcare better and make it more frictionless and allow these journeys of both our patients and our caregivers to really be smoothed out and be more personalized and feel better because it's nothing more painful than having a bad experience, whether it's hard to get into an appointment or maybe your care throughout the journey can be a little bit turbulent, or that bill at the end that you get. So we're looking at many different ways. So I was excited for the opportunity to join Utah to lead their digital transformation.
Awesome. So you said including patients and their families is part of your passion. How did you get to that? Because a lot of us care about patients, but it's really hard to really make that part of the forefront of our efforts. So can you describe how that became part of your passion?
Sure. So whatever organization I work for, I always become a patient there because I'm like a secret shopper. Like I want to find those pain points. I want to figure out like how we can improve and to remove any barriers in the system. A few years ago, I joined a patient advisory council, and that was really interesting because not only did I have a hat of a patient, but I had the IT hat on as well. So as I listened to folks around the table, I had a lot of aha moments. So for example, there was a woman, and she was of Hindu descent. And, she brought forward some of the things in her culture and background that I would not have thought of before. And so I think what really excited, and really sparked that passion was thinking through different people's lenses. And we often have our own blinders on, right? We only experience things through our own lens. And so it's really how can we increase our empathy and understanding for others. And, we might not ever walk in their shoes, but we can certainly invite their voice to the table so that we can think about how we might cater, the technology or a solution or a workflow slightly differently to be more inclusive and really be thinking through many different lenses and not just our own.
I love that point you brought up of sometimes, we talk about this often, that as IT folks, those that dedicated to the healthcare industry, sometimes we are patients, but we have our blinders on of our experience and our understanding. Having been on a PFAC and experienced that, how does that change or alter your approach to inclusivity, to diversity, DEI efforts at your current organization and perhaps past organizations?
Yeah, well, I think first and foremost, we are not just patients, right? We're employees. We are the builders behind the scenes. And so we think like, oh, we're representing the patient too, but we have to remember that we have to ask others for their opinions. And so at my last organization, one of the first things that we did was we actually stood up a patient portal specific work group that we invited patients to the table to test out some of our builds. So we were one of the first organizations to allow patients actually in a test environment as a fake patient. And I'll give you an example, through COVID-19, all the different testing and immunization and vaccination sites, we wanted to rapidly release features, but we would bring it to this core group of patients who can test in, our test environment and say, oh, I don't really get what you mean by this, or where do I go for this? And showing that, maybe misunderstanding of something was really important, because our builders are thinking, oh, we got this nailed down, but the workflow, exactly what you should click and what steps to take. And that might not be as apparent to a patient. And I think that's where digital literacy really comes in, because we have to remember that in the industry, we have a high digital literacy, and that might not be a full representation of the rest of our population. So that was one piece of it. And then the other piece is, just asking the patients, what is your biggest pain point? If you could change one thing, if you had a magic wand and could change something, what would it be? And one example that came forth is, when I'm typing my provider a message through the portal, I get cut off because there's a character limit. Can we increase that? And so, something as simple as that was really causing a lot of frustration and consternation amongst our patients. So we took that to the work group and came up with some recommendations, which then went to the steering committee, and which has physician representation on it. And they were able to vote and say, yep, let's increase it to 1,000 or 1,200. And that was an instant win. And we were able to then bring that back to the patient work group. And, not only did that validate their contribution and ideas, but it closed that feedback loop. And I think that's something that's so important in healthcare today is, what does the feedback mechanisms look like, and how can we take more proactive, or in the moment action to help, close that loop?
I think that's interesting. Just this last week, we heard from an organization that was encountering a similar problem where there was a character count issue. And so they were having patients that were sending 2 or 3 messages to the providers. And then all of a sudden you have this terrible clinician experience because they're getting their inboxes filled with patient messages. So I'd love to hear from you. How do you balance the needs of the patient with the needs of the caregivers, especially in today's environment where burnout is high, we have staffing challenges? In an ideal world, you meet both needs. How do you approach that?
Yeah, so at the University of Utah, one of a big goal is to have exceptional patient experience. And so that is a real driver from top down, which I think is the most important thing that any organization really needs to make sure of is what does your support look like? And from top down support, that actually helps really drive change. So, one of the, I think the balance between clinicians and the patient voice, I think that's where it's important for governance and to make sure that internally, when we are looking at solutions and change, we do have practitioners and informaticists, having a seat. And so they are able to weigh in and help, guide that direction. And they also want an exceptional patient experience. So if we say, here's what we're hearing from our patients, here are these pain points, when we bring ideas forward, they too want to help promote, better change. As far as, a volume of messages, that is certainly not unique to Utah. That is a pain point across organizations. And we are looking at ways of how can we, purge old messages, and, the vendors are looking at ways to suppress messages that, are things like thanks or thank you, just so that we're not clogging up their messages. And I also think that we could really rely more heavily on those clinical support staff to really help, triage or catch the ball before it gets, to the practitioner, because perhaps it's clear by the message that that person needs to come in. So let's invite them to a scheduled appointment and not just say, please call, but how about we offer sometimes, like take it to that next step. Again, removing that friction point. If we can offer them, hey, this sounds like, Dr. Jones is really going to need to see you in person to address this concern. Here's some available times, or allowing that direct scheduling to happen just will help improve that patient journey as well.
I like this discussion about balance, because it does, you really have to address all the stakeholder needs, and you've given some great examples there. And one thing we're hearing is that sometimes clinicians are hesitant to change things, and opening up their schedule might be one thing. And we know that University of Utah is known for opening up patient feedback and making it public, and saying, hey, we're gonna address this, and we're not gonna hide behind it, and which I think is fantastic. So I guess the question is, what else are you doing, or what else would you recommend to encourage clinicians especially to pivot towards more patient-centric areas of change, really?
I think the online scheduling and that access and provider schedules is the next, nut we have to crack. And one of the things that I'm working, the team is working through is really understanding what about this causes you the most angst. Where are your concerns with opening the schedule? Because for a primary care physician, for example, a new patient getting put into the wrong slot, meaning that they don't have enough time, that could wreck their whole day. However, a surgeon, might have a different fear. Perhaps it's not seeing enough new patients in order to, book cases and generate revenue. So I think that it's really understanding more by like service line or specialty, what causes you, the most fear with this. If we can understand that fear, then we can address that fear and say, okay, primary care, why don't we do a 2-week pilot? And we're trying to really move to this agile methodology of really thinking about quick change, reiteration, constant, looking at what works, what doesn't work, let's tweak it, let's redeploy. Instead of having something that's, this big bang where we, it might be too much to bite off at once.
Yeah.
So I think, being able to take a small pilot, building that trust and having certain key individuals, whether that be a chair or a chief or some subject matter expert, a well-trusted champion that can actually then say, yeah, this worked. I didn't have any problem, and then help, evangelize the idea to get more buy-in. So I think, when we think about like John Cotter's change management steps, like the burning platform is there, right? The urgency is there. We know patients want to be able to self-schedule and be able to get into appointments and change them and move them around at their own discretion without having to pick up the phone to call. And they expect it, right? They want on-demand care. They want things now and what's convenient at a location that's close to them. So, I think that because of that, then the next step is really making sure, we have that top-down buy-in, which is great. And now it's really starting to think about deploying these changes and almost like the small test of change. Let's tweak something, see if it works. If it doesn't, go back to the drawing board, tweak it again, redeploy.
Self-scheduling, we're on the same page. What we've heard from patients is this is top of mind. I'm curious, as you tackle this incredibly complex problem, are you looking to other industries for best practices? What are they doing with consumers? How are they handling scheduling? I understand, getting on a flight there's only a certain number of types of passengers and flight times and seats available. It's much more complex in the healthcare industry, but what best practices are you looking to draw from?
Great question. I certainly think that we can learn from all industries, whether that be our own, consumer shopping experience to the flights. You go to an airport, you barely talk to anyone, right? Those kiosks just showed up. It's not like you had training one day, right? Like, so it's just very interesting to think about how rapid other industries have been able to move. And they might have had trepidation, like, can those consumers operate these kiosks? How do we best roll this out? But if you recall, they did have like a concierge type service where someone was kind of roaming around, helping them. I mean, why can't our waiting rooms look like that, right? Why do we still have that traditional front desk that asks the same questions that you just completed during your electronic check-in? And so a big focus of Utah is thinking about how can we reduce, let's ask the patient the question one time. And whether we collect that information electronically or collect it, through, an actual human interaction, let's just make sure that it's once, because nothing more frustrating than filling out a questionnaire and then being asked the same questions, because now you've invalidated my time, right? I spent time, doing this, and for the care team to maybe not have that information or utilize that information, that could be frustrating. But to answer your question back, I think that certainly the banking industry, even the food industry has really nailed it. And I think the pandemic helped accelerate some of those self-service options for online ordering, being able to track exactly where you're at, where your food is, when is it going to be delivered, what's your price, and have it be a very consumer-centric focus. That's where we need to move healthcare. And I think when we really think about what are our main goals, is we want to make it easier for our patients. We also want to partner with them, make sure that they know that the care is inclusive of not only the patient, but their families and their caregivers. And then, I think the last piece is really thinking about, so making it easier for me, caring for me, and then that partnering with me. So how can we bring that together? And so it's a really exciting time.
We've talked about listening to patients and some of the things you're doing there, and listening to clinicians and guiding them through transition and transformation. What about vendor partners? How do you include them in all of this?
I think what's exciting is seeing how much is out there is really, it can be overwhelming, but also really exciting. So one of the things in joining Utah is in an academic medical institution. I've primarily worked for academic medical centers. There's brilliant minds. We have researchers, we have the health sciences, we have folks who want to do all this great stuff, and often they will be contacted directly by a vendor and they might want to pursue something. And so I think what's really going to be important is pausing to make sure, does that make sense horizontally, not just vertically, but across the healthcare system and across the continuum? How can we pick solutions that really are scalable and that are sustainable? So, vendors, we love seeing different pilots, like demos, and seeing if maybe let's try something. As a state organization, we have a very thorough procurement process that we have to follow, but there's certainly options for us to partner with or a vendor who we could try something and see about defining very tangible KPIs. And if in that 6-month period, or whatever that time frame, if we meet those metrics and we are seeing positive outcomes, that's where then we will involve procurement and go out to RFP or RFI, if depending on what route we want to go. But I think it's really, there's certainly no shortage of vendors in this space. And I think it's up to us to make sure we are doing our due diligence, because we don't want to miss the next big thing. And something that I love about University of Utah is that we do want to be, innovative and be able to disrupt the industry. And the way that we could do that is with partnerships and by using, our network and outreach to really think about how else we could bring in companies. And we have a pivot center, so that is our innovation center that actually works closely with vendors. So it's really an exciting time to be thinking about how can we continue to propel healthcare and think more horizontally.
The problem of so many shiny new objects is something we hear often. As so many vendors are coming across your desk, is there anything that you've seen, regardless of whether you partner with the vendor or not, anything that you just see as really innovative, patient-centric, that might be coming up on the horizon in the next year or two in healthcare?
Yeah, I think there's a lot of great work in the imaging space that is happening. You think about mammograms and how archaic some of that technology is, and painful. And so I think there's some new companies out that are more mobile and less painful for the patient. So I think there's some of that on the horizon, also including like a mobile MRI technology where that goes to the patient versus the patient having to wait often hours, if not days, before they could get into the scanner. I also think that, and something that we're exploring, that we're doing a pilot with, is for computer vision. So using camera and two-way audio technology to both microphone and speaker to be able to watch a patient to help prevent falls, to use algorithms and build that AI capability to understand if someone is in pain. So I think that we're piloting this first with our rehab center, which is really important because a lot of those patients have, spinal cord injuries that prevent them from being able to move all of their, their hands or their feet, or maybe they can't walk or talk at all. Maybe they're ventilated. And so we even have like sip and puff technology through a straw for those that are completely immobile. And I think it's just really exciting to think about how we can, how can we leverage technology to keep patients safer, keep them more engaged in their care, and be able to help them in some of their worst moments.
So Laura, with so much emphasis on consumerism, that's a word that keeps coming up in our circles, and I'm curious what you think will happen if we don't start to pivot more towards what patients and consumers ultimately need and want. What do you think would happen if we don't do more digital transformation to their favor?
Great question. So what's interesting, and I can't remember where I heard this, but so I can't give credit because I don't remember who said it, but patient sometimes, consumer always. So, we are only a patient, when we have that outpatient visit or an inpatient stay or going for that procedure. But the rest of the time, we are still a consumer of healthcare. And I think, Donna Roach, my boss, the CIO of University of Utah Health, she is wonderful because has even said, it's not healthcare, it's health and care. And let's separate that word. And she's very, it's been great to see that distinction because we want to keep people healthy. No one wants to spend time in the hospital. And there's this real emphasis on wellness. And when we're well, we're outside the four walls. So we really want to think about the consumer journey too, because how are we helping keep our patients well and, do more preventative medicine and, meet them where they're at. And I think that's, and this kind of piggybacks on the last question, I think another big future is, the remote patient monitoring programs, consumer wearables, different, therapeutic data monitoring type devices that can help inform the care team to be more proactive and less reactive. So I think it's really something that is kind of still untapped. We see different watches are collecting data continuously, but what else could we do with that data, to keep people healthy and keep them, outside of our four walls, but still have great touch points to let patients know that we are still caring for them.
That's great. So as we wrap up, I'm curious what advice you'd give any of your colleagues around the world. What else should we be doing to include patients in technology efforts and transformation?
I think my biggest piece of advice is thinking about when we are hearing patient voices, what does that representation look like? I think sometimes if we're trying to create a panel or even, that PFAC, is it really diverse? Does it really represent our community? And I think that is probably the most important thing is just when you think like, oh, this is diverse, I think we should pause and say, is it diverse enough? Does it really represent my community? Do my teams represent my community? And so I think that digital transformation is only as good as the folks, whether it be a patient, an employee, a consumer, how they can understand and utilize technology. If they don't understand it and it's not useful to them, then we've hit a roadblock. And I think you guys both know this, but the technology is the easy part. The people and the process are the tough parts. So the solutions are great, but if it doesn't align with a workflow, if it's not seamless, if it adds more steps or causes more barriers, then that is going to be, could be a failure. So I think that, really thinking about inviting everyone in, making sure that we really truly have a representation of those we serve within our communities, that's how we can really, move the needle forward.
Laura, you've given us so much to think about. I've got lots of notes I've been taking here. I love your vision and passion for this. Thank you so much. We appreciate what you've shared with us today, and I know a lot of our listeners are going to benefit from that. So any parting words of wisdom you want to end with as we wrap up today?
I think the key takeaway is to think about your care teams. The patient is part of that care team. Mm. And I truly believe that the patient is the most underutilized piece of that puzzle. And so think about more ways to invite them in, partner with them, make it easier for them, and then we can definitely continue to help promote the patient experience.
Thank you so much. Love that, and we're cheering you on. Thanks for what you're doing.
Thank you for having me.
Well, that was a great interview with Laura today, Adam. Really great insights, and I just love the casual conversation we were able to have with her. Tell me one or two things that stuck out from today's conversation.
I really like that she put herself on a PFAC, Patient Family Advisory Council. What a cool idea. Too often, I think vendors and providers say, well, I'm a patient, so I know what patients want. And we know that there's disparities there. Our report that we've talked about many times, Patient Perspectives on Engagement Technology, it shows the disparities and how patients are thinking of different things. So I really liked that. One thing I learned from her was, we really need to start anywhere and go anywhere, meaning if you approach digital transformation and engaging patients as, hey, I've got to fix everything today, it must feel like boiling the ocean. It's just not going to happen. But if you say, hey, I can change this. I can listen to my doctors and ask, what is your concern about scheduling? And let's address that. That feels much more manageable, I would think, to a healthcare executive. So that was a couple of the things that jumped out to me.
I loved, as she was talking about the consistent feedback loop she was getting. So put something in place, test it a little bit, get a little bit of feedback from patients, and then iterate on it. You don't have to have a perfect plan from the get-go, but you're looking for consistent progress towards something that meets the patient needs.
Makes a ton of sense, doesn't it? when she said the patient is part of the care team and it's the most underutilized piece of the puzzle. Wow. I heard choirs singing in the background when she mentioned that. Music to our ears, right?
I've actually heard this concept coming up multiple times in provider calls recently as organizations are looking to offload some of the burden. They have burnout issues at organizations, they're short-staffed, and you can almost treat that patient as an extra employee. They're part of their care team, but can you offload things in a smart and intelligent way to patients that engages them, but it also takes some of that burden off of you as an organization? I think in those cases, it's a win-win.
Boy, and in today's economy and the employment climate, that makes a ton of sense. You've got a willing, engaging patient that wants to schedule, wants to communicate, wants to provide data. That saves some FTE hours, so why not? Why not jump on that? So you and I both liked when she said, the phrase patient sometimes, consumer always. Sometimes we get lost in the nomenclature. When are they a patient? When are they a consumer? And that kind of flipped that on its head a little bit. We should always think of them as consumers. Sometimes they're patients. So how can we address both roles?
Yeah, it's really interesting as you think of the technology journey of a patient. It doesn't end when you leave the hospital and you're no longer a patient, quote unquote, right? Your consumer journey, as with any other industry you encounter, it comes and goes. It might ebb and flow a little bit, but you're consistently a consumer. I just love that concept.
Yeah, it was a great comment. Well, Dan, can you share any recent research or things you want to share with our listeners today?
Yeah, I want to tell you about one call I had with a CMIO of a large healthcare organization recently, and it ties in with the topics that we discussed today with Laura. This organization just went through a big EHR migration from one of the big vendors to another one, and as part of that, we were talking about patient engagement and how the transition went with the portal and some other pieces of technology. And I thought this was really fascinating. They were able to drive a relatively high adoption of their portal in a short amount of time since go live. But what they're really looking at as their metric of success is actually clinician time saved in this process. And what they've looked at is they see a 15% reduction in the workload on the clinician responding to messages for things that they've been able to offload to the patient. So they looked at where are smart opportunities to let patients self-schedule. They're still working on getting that into specialties, but for primary care and other referral type visits, they've nailed the self-scheduling. They're looking at prescription refill requests. Can they automate that rather than that being an independent message sent to that physician? And think of the burden that takes off of a clinician, the mental cognitive load that they may carry just to sort through each of those messages that they're getting. So I thought that was a really clear-cut metric that they looked at. 15% reduction in clinicians' time spent engaging with their patients.
Wow, that's great. Neat to see that hard data that supports the effort and can validate the change, right? So,
and it shows there's that ideal result of patient engagement technology efforts. Historically, they were very much provider-driven, and to get patients in, to save providers time, I really think there's the right balance, which is create a great experience for patients, and then the provider benefits and outcomes will follow.
You and I've heard that theme a few times over the past few weeks, haven't we, in different settings, that you really have to treat both stakeholders or answer to both, which makes sense, but it's not just all or nothing. Right. You can't just go in one camp and eliminate the other. They're just deeply connected. And so I think I've appreciated organizations both on the vendor and provider side that have called that out a little bit, and it's educating us. So good stuff. Thanks for sharing that, Dan.
Yeah, you bet.
Well, we really appreciate Laura Marquez participating in today's podcast. Laura, good luck to you. Thank you for your great leadership and passion. And we encourage others to follow her example of including the patients more and more in all that we do. We hope you'll subscribe to the podcast. We hope that you'll send over ideas for future episodes, either guests or topics. And as always, thanks for listening.